It's a late afternoon, early evening, and the scene is Nairobi, Kenya, in Africa. A young child playing unsupervised finds a blade and attempts to cut her toenail, with her foot propped up on the bed, as she has seen her mother and older siblings do so many times before. Startled at the idea of being caught, the child's foot slips the bed, and as it slips, the blade catches the side of her leg, leaving a gash that would require over 20 stitches to close. Naturally, the child yelps in pain as blood begins to gush down her leg. A neighbor working as a nurse in a local hospital runs over to try to help. Using the limited medical supplies she has, she is able to wrap the wound. The child is still crying. Given the time of night, the cost associated with care, the distance it would take to get to the local clinic, the child's mother tries to soothe the child as best as she can. Recognizing that she would have to wait until the next morning to start the walking journey to access medical services required to close this very deep wound. Abari Agioni, good evening. My name is Magdalena Nichols, and I am the Chief Officer of Administration and Strategic Partnerships here at Jericho Road. And that child in that story was me. Originally born in the Congo, I come from humble beginnings and have been the recipient of medical services provided by organizations like Jericho Road through their global health work, which would not be possible without your generous and ongoing support. For everyone tuning in from home, Asante na karibu, thank you and welcome. As you can imagine, this year has been unprecedented, not only for our nation, but for the world as a whole. Yet despite the challenges, I am beyond grateful that we are still able to gather virtually this evening to celebrate our global health work. With gratitude to sponsors like Riches and Rich Family Foundation, our presenting sponsor, and Bailey Lumber, our event sponsor, tonight, you'll hear from the leaders of our global health centers in Sierra Leone, Congo, and Nepal, as well as from our CEO and founder, along with one of our Buffalo-based providers. This evening, you will also have the opportunity to enjoy music and dance performances. At the end of the hour, we'll spin the wheel of names, loaded with names of guests who registered at $100 or more, to draw the winner of the Southwest Airlines voucher for two. Join the chat on Facebook Live. Our Facebook Live link is right on your screen. One of our team members is also in the chat interacting with guests. Post selfies with your selfie prop using the hashtag BridgingTheGap2020. With gratitude to Jabako for being our selfie prop sponsor. Don't have a selfie prop? No worries. We'd still love to see your pictures using hashtag BridgingTheGap2020. Our goal this year is to raise and exceed $325,000 for our global health work through Bridging the Gap Virtual. I'm excited to share with you to date, we have received donations and pledges totaling over $265,000 so far. This evening, I challenge you to 1, join us on this journey to bring quality healthcare services to those most marginalized in our world by helping us to exceed this goal. 2, help us to sustain this work by considering a monthly gift or an annual pledge. Thanks to the generosity of our board of directors and a few other committed donors, all investments will be matched up to $171,000. We invite you to give using the text number listed on your screen or the website listed on your screen. And thank you so much to everyone who has given already. At this time, I'd like to open us up in a prayer, followed by an introduction of our first presenter. Father God, I thank you so much for this evening. I thank you so much for everyone who has been able to join us today virtually to celebrate this amazing work that we're doing globally, Father God. I consecrate all of our teams and all of our staff abroad, Father God, asking for you to bring the necessary provision for us to continue to do this necessary and very important work as we continue to build forward into the uncertain future, Father God. I consecrate these prayer points and I consecrate everyone that is also listening to this presentation today, asking for you to allow them to listen to their hearts, and if they feel so compelled that they would give even the more towards this very important work. I thank you and I pray for this and all things. In your precious name I pray. Amen. At this time, I'd like to introduce our first speaker, which is Dr. Myron Glick, our CEO and founder.
Good evening. It's a privilege to welcome each of you to this event. My guests, not only folks here in Buffalo, but maybe around the nation and even maybe in our at our global centers in other countries, people tonight are watching this event. And so I'm especially honored to be able to welcome you and to thank you for your generosity over the years to this global work. This has been a challenging and difficult year, one unlike any that I can remember. Public health crises, economic meltdown, and now this passionate movement across our country to fight for racial justice. All of this happening, and all of it happening at one time, has made our work here at Jericho Road in Buffalo and really across the world especially challenging. As many of you know, COVID-19 has hit the communities that we serve here in Buffalo especially hard. And so our staff here in Buffalo, our doctors, our provider team, have had to really be in the fight these last 3 months. And yet I can stand before you right now and just acknowledge that God has been faithful to us and that we are continuing to work out the mission of Jericho Road in this difficult time. So tonight we're going to do an event to raise funding for next year for our global work in an unprecedented time. Last year, many of you were at our event. We probably had 400 people, close quarters. It was an amazing evening, a beautiful summer evening. We had speeches. Chantal visited from Congo. Fabian was here from Sierra Leone. There were no masks, no social distancing, and the event was amazing. We can't do that tonight. Instead, we're going to meet together still, but in a different way. And my hope and my prayer is this event this evening will be this shared experience that all of us will look back and remember as something that was good and worthwhile, and that it motivated all of us to continue to do this work. We need your support, now in this critical time more than ever. And so I thank you for being a part of this event and for supporting our work going forward. I grew up as a missionary kid. My dream all along when I decided I wanted to be a doctor was to go back to some country and be a missionary doc to deal with the medical need that I knew existed in our world. And yet when I got to medical school here in Buffalo, I was exposed to the way the poor are treated by our healthcare system. And God started moving in my spirit, and out of that came this call to start Jericho Road right here in Buffalo, to care for the most vulnerable, the marginalized, right here in this community on the west side of Buffalo. But then the world came to Buffalo. Over the last 20 years, folks refugees from more than 80 nations have come to our country, and they've come to Buffalo, and now they're at Jericho Road. And so we've had this amazing opportunity to be here for not only folks who grew up in Buffalo, but also for folks from across the world who need health care. And out of that has come relationships. Fabian was one such person. She came from Sierra Leone in 2001 with her family, fleeing one of the most atrocious, worst civil wars in the world's history. She barely got out of Sierra Leone with her life. When she got here, she was broken. Her family was in tatters. It was a difficult time. But God was faithful to her, gave her a new life, gave her family a new life. She became a nurse here and eventually came to work at Jericho Road. And in 2009, as part of our annual review, she said, "Dr. Glick, I'm tired of seeing and hearing the way my family members back in Sierra Leone are dying because they have no access to good health care. I need to go back. I need to help my people. Can you help us?" And I said yes. And that started this journey where Jericho Road decided to follow our friends back home to their countries and help and empower them to start these medical works, which are now today making such a difference in the lives of people in Sierra Leone, where we have 2 health centers, and Fabian is there working even now and leading this work. In Goma, in the Democratic Republic of Congo, where Chantel leads a work that's remarkable in how they're reaching people in Goma, one of the world's poorest and most challenging and unsafe cities in the world. And then in Nepal, more recently, as we followed our friends back to the mountainous, remote area in a village called Hagam and are building a health center there. Today, more than 5,000 people a month are blessed by this global work that you, each of you, are being so generous in supporting, and that God has been faithful to us. So tonight, I hope you are blessed by this presentation, and I hope that you will continue to support our work. Thank you.
Good morning, good afternoon, depending on time of day on your side. My name is Fibian Fengai Abdullahi, founder and director of our Jericho Road Ministries in Sierra Leone. We are located in the eastern part of Sierra Leone, in the Kono district to be specific. And Jericho Road started a clinic there in 2015. The clinic is called Adama Martha Memorial Community Health Center, where we provide basic health care to the underprivileged, the vulnerable, and those that cannot afford health care at a high cost. And we're providing these quality services at a cost recovery price or no cost at all to those who cannot afford, because healthcare is not a privilege but a right to every human being. And that's what Jericho Road stands for. Make sure everybody have quality healthcare regardless of your financial status, your social status, or likewise. So at Adama Martha Memorial Community Health Center, we are providing services like OBGYN, primary health care, pediatric care, doing minor surgeries like hernia surgeries and other like appendectomy and other minor surgeries. And we are also running nutrition clinic for the malnourished at no cost at all. And at this point, we've also established another location in the northern part of Sierra Leone in partnership with our other alliance organization called EduNation. It's also another needy area where we are providing same services, primary health care, OBGYN, pediatric care, and lately we've started doing surgeries there. That was a place where you had so many needs for men working so hard, and their work requires physical labor, which makes them eventually wind up with things like hernia, hydrocele, and the like. So we started doing hernia surgeries there as well. And to date, we've done well over 200 surgeries. And at the moment, we are still trying to provide for them at a cost recovery or no cost at all. So all of these will not have happened without your support. And therefore, this time we cannot meet physically to do a fundraiser as before, but we are reaching out to you again and say, please help us serve those vulnerable, those less privileged that are dying of ailments, of illnesses that no one should die of because they don't have money. So, reaching out to you today, we thank you for those that have given before, that have supported us so far in this journey, and those that haven't, now is your opportunity. We invite you to make our global work continues and help supporting those who cannot afford for themselves. When you look on the screen, you have number of phone numbers and contacts. Please support us, support our work by texting the numbers on your screen or click one of the donation buttons on the web page. We believe no one should die because they cannot afford to pay for their health care. Let us step up for them. Thank you, and God bless you.
I'm Seth. I'm a nurse practitioner with Jericho Road Community Health Center, and tonight I'd like to share with you a story that really demonstrates the meaningfulness and importance of our global work. In 2017, I was part of a team that traveled to Adama Martha Community Health Center in the Kono district of Sierra Leone, West Africa. It was our first night at the clinic, and earlier that day, a woman had come in labor. It wasn't until later in the evening that she actually delivered, and unfortunately power was out in the clinic because the solar cells had failed to store energy that day. So we were working by iPhone light. We could tell from our earlier examinations that the delivery was going to be a difficult one, so it was all hands on deck. Dr. James Stoltzfus performed the delivery. Heather Kim, a family nurse practitioner, and myself were there ready to receive the baby. Phoebe and Abdullah and two Sierra Leonean nurses were there to stabilize the mother after delivery. The baby delivered rather quickly with only about 2 or 3 good contractions, but we could tell right away that the baby wasn't doing well. She was very limp, she was blue, she wasn't crying and wasn't responding in any way. So she was quickly passed over to Heather and I. Heather started rescue breathing with the ambu bag, and Dr. James was trying to suction out her nose and her mouth and was trying to get her to respond. He was rubbing her chest, patting her back, flicking her little feet, but she wasn't crying at all or breathing. I was listening to her heart rate and monitoring that, and it was very slow for a newborn, and it was getting slower every second. Dr. James started CPR, and he began doing chest compressions. And every couple of minutes, we would reassess her heart rate and try to reassess her breathing, but the heart rate was not picking up. To date, it was probably the longest 10 minutes of my life. So Dr. James continued the chest compressions, and at one point, Dr. James paused in the compressions, and I thought for a minute, oh God, is that it? Is that where we're calling it? There's nothing else that we can do. And he looks around the room and he says, everybody's praying right now, right? I wasn't sure how to respond to that, and up until that point, I hadn't prayed for a very long time. So I just started praying in my head, God save this child, God save this child, God save this child, over and over and over again. And we continued the rescue breathing, and we continued the compressions, and we continued monitoring the heart rate, and eventually baby coughed and started to cry. And it wasn't the strongest cry I'd ever heard in my life, but we were going to take what we could get at that point. I've had a chance to reflect back on that delivery that night in Sierra Leone, and many things stand out to me. I'm so happy that the baby survived, but I'm so angry at the injustice and at the disparity that we see in the world today. In the United States, we would have had intubation supplies, we would have had oxygen, we would have had a sterilized room, a fully stocked NICU. We would have had specialists on hand to evaluate the baby, but we didn't have any of that. And when we were planning for the delivery and we were talking to Phoebe and we asked her if we could transfer the baby to Koidu General Hospital, the government-run hospital that's local. And she said that they wouldn't have been able to do anything more for her and they didn't have any more supplies than what we were doing. Another thing that really stood out to me is that the mother was not panicked. She wasn't crying. She wasn't yelling at us in her language to save her baby or to work harder or faster. She was very calm, and that struck me as unusual. But then I realized that this is the normal for her. She has to live the risks, and she is aware of the risks of delivering a baby in Sierra Leone. Sierra Leone has one of the highest maternal mortality rates in the entire world, somewhere between 1,100 to 1,300 deaths per 100,000 live births. 12 to 15% of children don't make it past the age of 5 years, and those that do survive, the average life expectancy is about 50 years. I do not accept this injustice, and neither does Jericho Road. In the United States, we have power and we have privilege, and we should use that power and privilege to make a difference in the world. Tonight, with your support, we can help more babies like the one we delivered in Sierra Leone. And with your support, we can provide quality health care to our global brothers and sisters. Thank you.
With gratitude to Independent Health and 716 Ministries as our entertainment sponsors, I'm excited to introduce the RiverRock Church Choir, who will sing 2 songs for us tonight. Enjoy.
Yahweh, Yahweh, Yahweh. everyone. Enjoy.
Wa milele Mungu wa baraka ni Yesu. 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 Eh, anaweza. Eh, anaponya. Eh, anaweza. Eh, anaponya.
Hi everybody, my name is Kevin Amon with Riches and Rich Family Foundation, and I'm really glad that all of you were able to join us here from near and far for this great event. Riches is proud to be the presenting sponsor for Bridging the Gap, and although Riches is a global corporation, we got our start right here on the west side of Buffalo 75 years ago this year, and we're still anchored here. It's one of the reasons that we have such kinship with Jericho Road is I think our shared understanding that we know in order to be successful you need to start in your immediate neighborhood and then take wherever the ideas and innovations lead you into the farthest reaches of the globe. So tonight I invite you to join us in supporting the life-saving work of Jericho Road's global health programs in Sierra Leone, the Democratic Republic of Congo, and Nepal. You can make a gift now by texting BTG to 91999 or donating online to the link on your screen. Thank you to so many of you who have already donated, and we hope you enjoy the evening. Next up, you'll hear from Chantal Mondro, Director of Jericho Road's Wellness Clinic in Goma, the Democratic Republic of Congo. Have a great night.
My name is Chantal Mandro. I speak for the Wellness Clinic of Jericho Road Community Health Center in Goma in the Democratic Republic of Congo. The Wellness Clinic is the health center. We treat poor and vulnerable people for free or at a low cost depending on the case. This is the reason why we receive many patients every day. We have the average of more than 2,000 patients per month. Last year, we received help money to extend the clinic for the building of the surgery and the maternity, and this was increased the number of the delivery cases. Last year, we have delivered 943 women, 563 totally, and 380 have the C-section. We have already bought the land for the malnutrition program and the building is in progress to have the secure place to give a good care for these children. We are very happy for the help you give us for vulnerable people in our country, where the war has been going on for over 20 years has made people miserable. Without this help, many people would have already died, like these malnourished children that we take care, and there's pregnant women that we are helping. We invite you to join us in invest in our mission to serve the people of the DRC who need more help. You can make a gift by sending a phone number or your screen or donating to an event website. Thank you for your consistent support.
Our lives are full of joys and sorrows, dreams realized and hopes dashed, moments of great togetherness and times of great division. In this moment, it feels like the entire world is facing all of these tensions clashing together at once. When big challenges like disease, social unrest, war, and famine face our world, the poorest and most vulnerable are always hurt the most. But this pain is not inevitable. When we invest attention, resources, and expertise in areas of the world that have been overlooked for too long, what we're really investing in is change. Malnourished babies grow into thriving children. Mothers who dangerously labored at home become women who safely deliver new life into experienced hands. Men and women who have carried the burden of disease or injury for months and years transform into strong, healthy adults. And whole communities flourish when they can turn their focus from merely surviving to joyfully living. At Jericho Road, we believe that healthcare is a human right. You can help make that right accessible to everyone. Join us as we renew our investment in our global health teams and our patients around the world. Change will only come if we all work toward it. Let's get to work.
I hope you were all up dancing and celebrating as you heard that music, and you were celebrating just the support that you've helped us to do in your donations to support this work. And so far you've heard from our CEO and founder, Dr. Myron Glick, but there's still more to come this evening. At this time, I'd like to share with you that we are at $175,000 towards our fundraising goal. If you haven't given already, we invite you to give using the methods listed on your screen. We also invite you to consider signing up as a recurring global donor at a gift amount that's most meaningful to you. As you may know, no gift is too small in supporting this work. For example, a gift of $10 a month might not seem like a lot, but in 1 year, that would cover the cost of 1 C-section in the Democratic Republic of Congo. And if you feel called to sign up as a recurring donor, please head over to our donation form on the event page and select the donation frequency that you prefer, monthly, quarterly, or annually. As a reminder, if you haven't done so already yet, please snap a photo of yourself with your props and put it up on the Facebook page using the hashtag BridgingTheGap2020. Here's a selfie picture of Mary Ann James, who posted this selfie on Facebook using their selfie props. And if you don't have a prop, still post your picture. Now, we're going to hear from Pastor Ashish leading our team in Nepal.
Hello, Jericho Road family. Namaste from Nepal. I am very glad to be a part of this meeting. I am Ashish from Nepal. I am the Director of Operation and Special Care Coordinator of Jericho Road Nepal Community Health Programs. I have been working with Jericho family since 2017 and serving medical facilities in Hagam, a remote village of Nepal, which is also my birthplace. Jericho Road has helped us to do clinic twice a month in Hagam and Havra since 2018 July, and in Havra we used to do clinic at school, and while we did the clinic there, we had a disturbance with the school, and the school had disturbance from the medical team because of the crowd and noises. But in Hagam, we had to set up a clinic in the yard of someone's house, and when it rained, we would carry all the medicine, and after the rain stopped, we would take the medicine out again and start the clinic. But the good news is from July of 2019, Jericho Road has supported us to do clinic in a rented place, and since then it is very easy for us to run clinic. And after the continuous camping from 2017 to till now, many people have received the service and facilities. My father and his brother have donated their land on Jericho Road for construction of the clinic. The last time Dr. Glick came with his team in October 2019, we made a simple sketch for the building, and according to that, the engineer was working on the final stage of the sketch, and the sketch was to be completed by now, but the work has been stopped due to COVID-19. And according to our plan at that time, we had the concept of constructing two types of building. One is a clinical building and the other is a guest house. An earthquake struck in Nepal on April 25 of 2015, and it blocked all the roads for 2 years. When Dr. Paul and Pastor Purna arrived in Nepal in 2017, the government was working on the road and still had kilometers to go to reach Hagam. At that time, all the villagers used their local equipment to open 1 kilometer of the road, and we were able to complete the medical camp. There is no hospital, medical center and pharmacy in Hagam, so those people have to travel 120 kilometers to reach nearest hospital. But if we could build a hospital in Hagam where we have pharmacy, lab, CT scan, X-ray, and have facilities for pregnancy, and have orthopedist, neurologist, doctors, about 4 million people from 3 districts would be able to get service, and they would not have to travel 120 kilometers for the normal patient. I personally thank Jericho Road and all the donors who showed generosity towards the Nepal people of the Nepal. Your grant is not in vain here, but it has given relief to the many people, and many people have not suffered because of your help, and they are living happily. I hope We will continue to work together in the future and help people in need. Thanks to the Jericho Road family for this meeting. God bless you all. Thank you. Namaste. Jai Masi.
I want to take a few minutes just to give you a sense of how COVID-19 is affecting our global work and in Sierra Leone and Congo and Nepal. It obviously is a public health crisis in these places. The healthcare systems are already broken. There's probably just a few ventilators in each of those countries. Imagine what it's like to take care of someone in severe respiratory distress, and you may not even have oxygen, sure don't have a ventilator to help this person. Thankfully, so far, we haven't seen any cases of COVID at any of our sites. And in each of the countries we are in, the cases are not too many at this time, but we worry that this could be a problem in the days and months ahead. What has been probably a much bigger challenge has been the lockdown that was initiated in each of these countries all the way back in March. There's the ability of folks to travel within the country is limited. There's no international flights in and out of any of these countries, and their borders are locked. And this has had a major disruption of the supply chain that allows people to have food and other basic things that they need to sustain life. People basically in the countries that we work in are day to day when it comes to food, and so any disruption in that supply chain is having significant consequences. It's causing political unrest. It's a big problem. So we, from the beginning, told our teams in these countries, we're going to continue to supply you the financial support that you need to continue to do the medical work. And we're going to do everything we can to get you extra support to meet the growing need in the people that you care for food and other basic need. And thanks to many of you who have given, we've been able to do both. And we're grateful for that opportunity. And honestly, I just am asking you all to pray for each of these countries that the virus will not continue to cause the disruption that it's causing right now. So many people are suffering. I want to, for the rest of my time, talk about what our plans are for this coming year at each of our global sites. Now, as we all know, COVID and all that's happened this year could easily change our plans, but here's what we're thinking tonight we will focus on in the coming year. We're going to continue to support the medical work. It's growing, and we're grateful for your support to allow us to do that. But at each of these sites, we have some clear goals of what we hope to accomplish, some new things that are happening. First of all, in Sierra Leone, Fibian is poised to start a third health center. You know, we have Adama Martha in Koidu Town, the original site started in 2015. Rokassa, a partnership with EduNation, started in a different part of Sierra Leone in 2018. And now, hopefully this year, Fibian will start a health center in Kumuru, about an hour away from Adama Martha, in a mining town which has major needs for clean water, for sanitation, and for healthcare. And we hope to start this healthcare center and would be grateful for your support in doing this. We're also excited to be supporting a CHO, or a physician's assistant equivalent, in medical school. When he graduates, he will become our first full-time doctor in a country where there's only 120 doctors. This is a huge win for Fibian and her team. And we're going to continue to invest in ways to make our work sustainable in these places. For instance, Fibian continues to build this farm. It's now 6 acres filled with all kinds of interesting plants and fruit trees and animals. And the profit from this farm is helping to sustain the clinic. And in Rokassa, we're building a food store in this remote village, and the profit will also help to sustain the clinic. In Goma, we've committed to expanding maternity care. Thanks to a generous donation from a national family foundation, we were able to double the space, and now we're delivering close to 140 babies every month at this health center. And we are building a feeding center and education center in a community right next to our clinic to help the malnourished children that we see. In Nepal, we hope to build a health center starting this fall. I'm so excited about this opportunity in a remote, beautiful village of Nepal with tremendous medical need. This opportunity to build a health center, we've already raised half the funds. We're counting on God's faithfulness and your generosity to get us the rest of the way home. We want to start this health center. Every day, I'm humbled and grateful that God has been so faithful to this work, and that each of you have been supporting this work, some for 10 to 12 years. Thank you for doing this. God bless.
We hope you're enjoying your evening with us still. With gratitude to Independent Health and 716 Ministries as our entertainment sponsors, I am thrilled to introduce Lynette Simmons from the African American Cultural Center right here in Buffalo. She's going to show us how to do a traditional dance from the Malinke people, a group who are primarily located in West Africa. So stand up and get ready to dance.
Hi, I'm Lynette Simmons, the Artistic Dance Director here at the African American Culture Center, located in Buffalo, New York, 350 Maston Avenue. I am going to be teaching a dance called Soli, done by the Malinke people. It is a ritual dance for young boys initiated to become young men. I am going to do a performance straight through, and then I'm going to do a breakdown of the movements of the piece we're going to be doing. Now I'm going to teach this movement step by step. First movement 8 times into a combination. 5, 6, 7, and 1, 2, 3, 4, 5, 6, 7, 8, combination, and 1, 2, head down 4 times, and 1, 2, 3, 4, combination, up, up, head down. Next movement, stepping out to the side, turning around. 5, 6, 7, and 1, 2, around, around, out, out, around. One more time. Hit, hit, and stop. Next movement, arms to the back, around, head back and forth. Legs are going back, up. 5, 6, 7, and 1, 2, 3, 4, 5, 6, 7, 8, and stop. With every movement, you need to elevate yourself. Going down and up. Next movement, stepping out. 1, right, left, right, left, right, left, left, right, left, down, right, left, right, left, right, left, right, 2, 3, 4, 5, 6, left, right, left, 1, 2, 3, 4, 5, 6, 7. Arms are doing the same thing that your legs are doing, your feet. So you're going down, push down, back, 1, 2, 3, around. 1, 1, 2, 3, 4, 5, 6, 1, 2, 3, 4, 1, 2, 3, 4, 5, 6, 1, 2, 3, down. Together. 5, 6, 7, and down. 1, 2, 3, 1, 2, 3, around, down. Push, push, push. Down. 1, 2, 3, 4, 5, 6. One, 2, 3, stop. Thank you. Keep doing the movements over and over again, and you will have it.
I hope you are all up and dancing. As you know, we're almost at the end of our time together, but before we wrap up our time together, we're gonna get ready to spin the wheel of names to give you an update on the winner of our Southwest Airlines ticket winner. Hold 1 second. And the winner is David, as you can see on your screen. David, we'll get a chance to connect with you and get those tickets over to you soon. Now, let's take a pause to look at where we are with our fundraising goal one last time. We invite you to give if you haven't already. As a final note, I'd like to share with you that the cost of doing this work and sustaining it is very important to our global work. Over the course of our current fiscal year, our global work will cost over $740,000. This amount, which can equate to the cost of a home and a vehicle here in the States, supports the operational cost of our clinic here in Sierra Leone, Congo, and Nepal. I say this to demonstrate that your support goes far at our global health sites. Your gift of $100, $500, or $1,000 stretches far beyond what you can think or possibly imagine and puts life-changing care into the grasp of our neighbors globally. As you can see, we're currently at $176,400. Again, any investment you make tonight will be matched dollar for dollar up to $161,000. Because of the generosity of our board of directors and committed matching donors, so your contributions at this amount will go especially far. We are also accepting donations after this live stream. You can give online on the Bridging the Gap website, or you can send a check to Jericho Road at the address listed on your screen. Again, let me just make one correction. So far we have brought in $276,000 for $276,400. So join us in closing this gap. You can still give, and our live stream will be available to you after this event. Again, Asante Tena. Thank you again for joining us this evening, and have a blessed night.